please take a moment to review the following.
Suspended fetuses, in this book, in this Chinese Medical Obstetrics by Bob Flaws, he has it as depression in pregnancy, but it's not. It's got. You'll see what the association is, but it's not specifically the treatment of depression during pregnancy. It's physical. It's physiological, and so there. We'll talk about sort of the mechanism of it first, and but basically the symptoms are that you feel really stuffy in the epigastric area, and it often comes later in pregnancy when the uterus is starting to get big, and the woman may feel that, of course I feel this way because my uterus is getting bigger and it's pressing up on things. But there's no reason that a woman should feel uncomfortable that way during pregnancy. You know, the uterus is expanding, the organs are moving, and you should be able to breathe and digest just fine all throughout pregnancy. And so, you know, she may think that it's normal, but it's not. And so it's like epigastric distension, rib side distension, chest oppression, and it can also go along with like poor appetite. And it also can either be caused by liver depression. So liver depression stops the free flow of the qi mechanism. And it can often be caused from liver depression, so it can be related to depression. You know, if something goes on, the woman's upset about something and she can't express it, it can block the qi mechanism. And on the other hand, if a woman has a blockage in the qi mechanism of the epigastric area, she can become depressed. Because you get chest depression, you can't breathe very well, your oxygenation isn't good, you know, so you feel lousy. So, so talking about some basic principles, one is that what Fu Qingju says is that that the fetus, that it's a lack of nourishment of the fetus, and the fetus, in search of help, goes up seeking nourishment. So it's like this fetal suspension, the fetus going up to look for nourishment. So we'll want to give some nourishment. So we'd be using herbs like dongui, baishao, renchen to give nourishment to the fetus. But at the same time, there's this upward moving, but we want to be careful. We can't down bear to make the fetus go down. You know, it's not like we'll use da huang or niu shi or, you know, something like that to make the fetus go down. And so basically, you want to give nourishment, and you also want to open up stagnation. You want to resolve the stagnation and nourish at the same time. We have 2 formulas here, and then I also added this morning another case, and so the cases are, the first one is where it's caused by liver depression. You know, so the woman gets depressed and it blocks her qi mechanism, and she has this fetal suspension. The second case we'll see is more that the spleen qi got blocked and it blocked up the mechanism, and therefore there's fetal suspension. So the causative factors are different, and therefore the treatment is different. So one is resolving liver depression, the other is opening up the spleen qi. And so what we'll want to do when we're diagnosing people is to look at the causative factors and to see, you know, what is the cause of this? Is it a problem with the spleen, or is it a problem with the liver? And, you know, and we can also adjust if we're not sure. We can try something. We can also, you know, mix treatment principles. And the third case that I translated a couple weeks ago by Dr. Zhu, what's interesting about this case is that he diagnosed this patient with heat in the liver. So not only liver depression, but depressive heat. So we'll look at so what you can do if there's also heat. The first formula, there's Zitsu-san. You can see why I put this in the morning sickness category, because it could also be, and I don't really have morning sickness, I just feel stuffy and full, but this is usually a little later in pregnancy too. And it may even go along with some acid regurgitation or poor appetite, but it's not really morning sickness, it's fetal suspension. So we look in this formula and we see the blood nourishing aspects. We have a bunch of suotang, we have bai shao, dangui, a little bit of chuanxiong, and also renshen and gancao. And then for the spleen part of it, we have zitsu ye, dafu pi, and chen pi. And we'll see when we get to polyhydramnios as well, like these are really typical herbs. In fact, peels are really typical herbs for regulating the qi of the digestion in pregnancy. So we have baiju, fuling, chenpi, but then also if we want to regulate the qi more for stagnation, then dafu pi, zitsu ye, chenpi. We also will see like fuling pi, shenjiang pi. We'll see some other peels a little later on. But so we're opening up the spleen energy, but at the same time, with the bai shao, dangui, renshen, and chuancheng, we're helping, really what we're doing is we're helping promote the blood flow through the placenta. So the fetus is getting enough nourishment, so it tends to want to go down where the nourishment is. So the Zitsu-san is from Judanshi, and then we have Jieyu-san by Fu Qingju. And again, we have these nourishing aspects with renshen, baiju, fuling, baishao. And then to open up the liver, zhichao, which is the same as zhike, sharon, and zhizi. Also, we remember about zhizi that, that the pressure pain here is diagnostic for zhizi. So when you have depression with pressure pain at the xiphoid process, it's diagnostic for using zhizi. And also liver depression develops easily into depressive heat, but it specifically brings down the qi from that area. Case 1 of Dr. Cho's, Ms. Shao was 37 when she came for her first visit in March 1957. She was overly depressed with the result that the fetal qi was not harmonized. Both sides of her ribs and chest were painful like a bowstring. This was a case of liver qi depression and obstruction. The fetus lost the soft, cool environment of the blood, and so it had to rise. Her pulse was deep and wiry, the body of her tongue was slightly moist, and the moss was thin and white. For treatment, I decided to course the liver qi's depressive clumping and nourish the liver blood. I used Fu Qingju's Jieyu Tang Relieve Depression Soup with modifications. So here she modified also with dangui. Then after that, Ms. Shao's chest pain was gone and the fetal suspension calmed. Her pulse changed to moderate and slippery. The tongue moss was the same as before. From the above prescription, I removed the zhizi and added shihu and continued with 5 packages, and the illness didn't return.